Hi, I am Melissa, and I work with Dr. William Collins, a board-certified neurotherapist at Reintegrative Health Institute in St. Louis, Missouri. Some of the more common questions people ask Dr. Collins are related to the cost of testing for learning disabilities. What does brain mapping or a QEEG assessment cost? And what is the fee for the neurofeedback therapy? Working with the professional to obtain testing for learning disabilities, brain mapping, QEEG, or an academic assessment will help the person understand if there are any issues with how the brain is functioning. Dr. Collins specializes in brain mapping, or QEEG, which is a measurement of the brain and its electrical activity. It typically takes a neurotherapist or trained technician about 2 hours to complete the QEEG assessment. The total cost will depend on the experience of the provider, board certifications, QEEG databases used, as well as the time involved in analyzing the data and presenting the report. Generally, the cost for a brain map or QEEG will range from $800 to $1,000. The QEEG shows how the brain is functioning and helps determine the underlying deficits in the brain.
My name is Dr. Collins. I'm a board-certified neurotherapist who's been in practice for over 35 years. What I'd like to do now is to give you a brief overview of what quantitative EEG is and how it can help guide neurotherapy. In order to record the electrical activity of the brain, EEG, a special cap is used. There are 21 electrodes that record and then transfer the brain's activity to a program that can compare the recorded EEG to a normative database. The image you are now looking at is a summary of the QEEG findings. On the first 2 rows, the coloration indicates problem areas. On the next 3 rows, I'm able to see where communication between the brain areas is problematic. Another way to analyze brainwave activity is to place the EEG on an MRI template. Knowing what area of the brain is generating the EEG allows me to understand what brain functions are compromised. A third way to analyze the EEG is to look at a 3D representation of the brain. The result is a clear view of where the abnormal EEG activity is located.
Once these deficits are determined, neurofeedback therapy may be an option for treatment.
A neurotherapy session begins with the placement of electrodes on the head based on the quantitative EEG analysis. This screen allows me to create the complex feedback criteria that guide treatment. Feedback is a 3-step process. First, EEG is recorded second by second. Next, the EEG recording is compared to the changes needed as determined by the quantitative EEG. Now feedback begins. When the EEG pattern changes, something changes on the screen in front of the person in treatment. The next screen will show exactly what this looks like. The essence of neurotherapy occurs on this screen. The initial assessment tells me what brain functions are compromised. The goal of treatment is to help the brain move towards optimal functioning. Now imagine you're a child sitting in the chair with electrodes on your head. You're watching a video. You notice the smiley face is happy, and the number in the upper right-hand corner keeps getting larger. You're probably most interested in watching the movie. Then you notice every now and then it stops. The smiley face and the number are no longer increasing. You remember what I told you. Just relax and stay focused. You then try to relax and focus on the screen in front of you. The movie starts to play. The smiley face is happy again, and the number keeps getting larger. It's hard at first, but every time you come in, you are more and more aware of how to stay focused and relaxed. Session after session, the brain shifts into more and more optimal functioning. The brain is learning how to stay focused and relaxed. Everybody around you begins to notice the changes.
And besides, you're hideous to look at. That's extremely rude. listen to him, Balthazar. You're classically handsome. It's not right to steal, but we don't kill people for it. Come out! Come out this instant!
If you or someone you know is struggling with children with learning disabilities, children with ADHD or ADD symptoms, sensory integration dysfunction disorder, or any type of child discipline issues, check out our additional videos. For more information about brain mapping, QEEG, or neurofeedback therapy, be sure to visit our website, www.learningdisabilitiesstlouis.com, and download a free copy of Dr. Collins' special report.